Welcome everyone to the Wandering Nurse Practitioner discussing academics and travel. If you have any questions or further questions, you can always send me an email or consult with your provider for other questions and concerns. Iron deficiency anemia is going to be discussed in this vlog. Iron deficiency anemia is a diminished red blood cell production due to a low iron stores in the body. Serum ferritin of less than 15 micrograms per liter for all pediatric age groups. So iron deficiency anemia is defined then as children that are 6 months to less than 5 years, a ferritin level of less than 15 micrograms per liter, and a hemoglobin of less than 11 grams per deciliter, and for children about 6 months to 5 years. Children who are 5 to less than 12 years old, a ferritin of less than 15 micrograms per deciliter, and a hemoglobin less than 11.5 grams per deciliter for children 5 to 12 years of age. So what is the pathophysiology behind iron deficiency anemia? Iron is connected in the heme protein, hemoglobins, and myoglobin. The remainder of it is bound in storage proteins like ferritin and hemosiderin. And a small portion of it, about 3%, is connected or bound in enzyme systems. So at birth, a healthy term infant have iron stores of about 75 milligrams per kilogram, and so 2/3 of which is connected to or bound to hemoglobin, and the mean hemoglobin concentration of about 15 to 17 grams per deciliter. These infants have sufficient iron stores to support growth and development at least for the first 4 to 6 months of life. So the common dietary factors that can lead to iron deficiency anemia are the primary cause of it. So examples include insufficient iron intake, inefficient absorption due to dietary sources of iron, the introduction of unmodified cow's milk, like non-formula cow's milk before 12 months of age, any occult blood loss secondary to cow's milk, protein-induced colitis, and also obesity. The insufficient iron intake in infants less than 12 months of age is due to breastfeeding without the initiation of adequate iron supplements by 6 months of age, formula with insufficient amount of iron, or early transition to cow's milk. The insufficient iron intake is very common in breastfed infants between 6 to 12 months of age, even though they have food to complement like iron fortified cereal. The insufficient iron absorption during iron deficiency anemia is dependent on the form of iron ingested, like heme versus non-heme iron, and the other foods that are consumed at the same time. So the unmodified cow's milk in infancy, the early introduction of it is an important risk factor. It increases intestinal blood loss in infants compared with formula, or like the excessive ingestion of cow's milk, drinking more than 24 ounces or 720 ml of milk daily, and in young children is also an important risk factor for iron deficiency due to the low concentration and the bioavailability of iron in the milk. So what are the diagnostics? So a complete blood count is very important. This is very helpful to determine the mean corpuscular volume, or the red blood cell size. Although iron deficiency is the most common cause of microcytic anemia, up to 40% of patients with iron deficiency anemia will have normocytic erythrocytes. So iron deficiency should still be considered in all cases of anemia unless the MCV, or the mean corpuscular volume, is greater than 95. So other causes of microcytosis includes chronic inflammatory disease, lead poisoning, thalassemia, and sideroblastic blastic anemia. So you get a serum ferritin, and ferritin reflects the iron stores and is the most accurate test to diagnose iron deficiency anemia. And it's also an acute phase reactant and can be elevated in patients with chronic inflammation or infection, just to keep in mind. So what are the plans for someone with iron deficiency anemia? So in children, iron therapy should be tried initially, and then the guidelines recommend empiric treatment up to 2 years of age. However, if the hemoglobin level does not increase, like by 1 gram per deciliter or 10 grams per liter after a month of therapy, further evaluation should be indicated. So the dosage of the elemental iron to treat iron deficiency anemia in adults is about 120 milligrams per day for 3 months. And the dosage for children is 3 milligrams per kilo per day and up to 60 milligrams per day. And so an increase in hemoglobin of 1 gram per deciliter after a month of treatment shows an adequate response to treatment and confirms the diagnosis of iron deficiency anemia. So in adults, like in a more older children, therapy should be continued for about 3 more months after the anemia is corrected, so that there will be so that to prevent iron stores from getting depleted. Also, it's a good idea to let your patients know to eat iron-rich foods like meat, dark green vegetables, iron-fortified cereals. Don't give more than 20 ounces of milk per day. Counsel also on the risk of constipation with iron intake. And so if kind of like stools harden, you can give prune juice, pear, apple juice. If you want to prevent the sugar, water is very important. And if they're greater than about a year of age, take it with 2 to 4 ounces of orange juice to increase the absorption with the iron intake. So, and then recheck the labs in a month or 3 months for older children. So I hope this helps about iron deficiency anemia. Again, consult with your provider for further details or questions and concerns, and you can also send me an email. So thanks again, and I hope this vlog helps. I'll see you guys in the next vlog.